Welcome to a new episode of Your Health Matters, a series of televised discussions and town halls presented by Montefiore Einstein in partnership with Bronxnet Television and Bronx Health Reach. I am Javier Gómez on behalf of Bronxnet.
And I'm Liz Spurrell-Huss, Director of Community Health Programs at Montefiore Einstein. It's a joy to welcome you today to this new installment in a series that highlights the most important health issues for local communities. Center stage.
Today's program is in the form of a town hall. We have a panel of experts and a live in-studio audience.
Javier and I will guide the conversation that will include questions from the audience today.
The topic today is flu prevention.
Our goal is to explore all the perspectives on the importance of getting the seasonal flu vaccine while dispelling common myths and addressing barriers to flu vaccination within the community.
This program is brought to you from Bronxnet's new studios and Multimedia Education Center at La Central in the South Bronx.
Javier, are you ready to meet our four panelists?
Oh yes, let's get started.
All right. Joining us today, we have Cheikhou Oumar Ann, community health worker at the Bronx Health Reach Institute for Family Health.
We also have Dr. Ellen Lee, Director of Respiratory Pathogens at the Bureau of Communicable Disease of the New York City Health Department.
Also joining us is Dr. Brenda IJ Anosike, who wears multiple hats at Montefiore Einstein, including Director of the Pediatric Residency Program and Pediatric Diagnostic Stewardship at the Division of Pediatric Infectious Disease.
And we have Andrea Fuller-Williams, Administrative Nurse Manager at Montefiore Medical Group and Health Minister's Director at the North Bronx Seventh-day Adventist Church.
Welcome to our guests and welcome to our studio audience.
Welcome. Every year, influenza or flu season knocks on our door from early fall to the spring. Peak activity normally happens between December and February.
But flu can also be spread all year round. It is estimated that flu-related deaths in the United States can surpass 20,000 each year, according to the Center for Disease Control and Prevention. So how do we prevent the flu and protect ourselves and our loved ones? And what is the vital role of flu vaccination in flu prevention? How does the vaccine work? What are common barriers preventing people from accessing it? Those are some of the questions we'll be answering and addressing today.
For this first section of the discussion, we will ask each panelist to comment about the impact of the flu and the importance of the flu vaccination through their very diverse experience areas. These range from medical perspective to faith-based and community outreach. So let's start with the public health and medical experts. Dr. Lee, flu season and flu vaccination, your thoughts to start.
Sure, thank you so much. You know, I'm a pediatrician by training, and even though I work in public health, I always have an eye to issues that affect kids. And I wanted to highlight that last year was a pretty severe flu season, and in the U.S., we saw 280 children die of flu-related diseases. That was the highest number that we've experienced in the last 15 years. And that is a striking number, but then beyond that, among those kids, 90% of the kids who could have gotten a flu vaccine were not fully vaccinated. So numbers like that really, I think, just highlight the importance of this kind of work that you're doing here, this sort of event, and the need for additional outreach about flu and flu prevention.
Dr. Anosike, your thoughts and observations from the pediatric perspective?
Yeah, no, thank you so much. And just piggybacking off of Dr. Lee, as a pediatrician that is also trained in infectious diseases, this is something that is very near and dear to me, and obviously an important issue now as we're starting to see a rise in a number of flu cases, particularly this time of the year. And one of the things that we do know is that the flu vaccine is the best way to prevent a child from having, or any vulnerable individual from having, significant disease. And so we do know that the vaccine prevents hospitalizations, it prevents even complications of the flu, complications being pneumonia, as well as even what we're seeing cases where it's affecting the brain as well too, and even potentially death. And so this is a very important conversation to have, and I'm very happy to be a part of that conversation.
Cheikhou, as a community health worker who does hands-on-hand, one-on-one work in local communities, what are your thoughts and observations?
Okay, we hear a lot of stuff. We are the one that the bridge between the community and the doctors. So what we hear a lot of misconceptions, a lot of positive stuff. So just like what she said, so many people, we have so many misconceptions in the streets. So what we hear is people ask, they would say they're healthy, and they forget they can spread the flu. And sometimes they would say, it's too many shots. And sometimes we have to let them know that they still need to take the shots and explain them what they're scared of doing. Sometimes what they would say that they're putting some more vaccines on me, 2 more vaccines on me, and they don't know it's just a protein they're putting on them, a little of that vaccine they're putting on them, so make them very confident about what they're getting. So this is exactly what we hear all the time in the street.
Andrea, what are your thoughts and observations, both from a nursing perspective and a faith-based perspective?
Well, thank you for asking. I'm going to speak from a faith-based first. So from a faith-based, they're believers, and they believe that God will protect. We also believe that our health is of much importance. So working in the clinic setting, I'm going to do both. Working from the clinic setting, I've seen the children as they come in, the seniors over 65 as they come in, and some of them we know with the comorbidities, they need to have their vaccines. So what I do teach is, because I'm in both the clinic, where I have to encourage and educate the patients to take the vaccine, I take with me to my congregation where we believe in brotherly love, and we hug and we kiss as we greet each other in Jesus' name, as we would say. We know that it's contagious and it's spread through respiratory. So in hugging and touching, we can pass it along. It's contagious, as we know. So we educate and encourage the congregation and in the clinic to make sure they follow the hand washing and wearing of the mask. Stay home if you're sick. So those are things that we do from faith-based and in the clinic setting.
Before we dive deeper into flu prevention and the importance of flu vaccination, let's briefly review what is the flu. What are the common symptoms? How does it spread? Why do we need annual flu vaccination? Everyone in the panel, feel free to jump in.
Yeah, I can jump in. When we talk about influenza, influenza is the actual manifestation or disease process from when you're infected with the virus. The name of this virus is called influenza, so it makes it easy, right? The influenza virus causes influenza. What is influenza in itself? What this does is that it can cause a whole host of different symptoms, namely fevers, very high fevers. It can also cause muscle aches, so you may have feeling a little achy as well too. You also can have cough. In addition to that, runny nose, headaches, a whole host of different symptoms, particularly even in children. They may have some stomach pain, stomach aches, and even some diarrhea as with that as well. So it can affect multiple different areas of the body as the virus sort of travels in various different parts of the body. But namely the one that is most common is the fever and also cough and runny nose.
Why do we need a yearly vaccination? I know you have answered this question many times. You're going to go like, here we go again. Please do it again.
Sure, I could take that. So for, unfortunately, the flu virus, it changes. It's sort of constantly changing. And so even though you might have had the vaccine last year, you might have even gotten sick from flu in the past, it won't give you immunity for the next season's flu virus. So each year there is a whole process that happens. That's it's a process through the World Health Organization and through our own national, local, national public health leaders, where they look to see what are the flu virus strains that are circulating in other parts of the world, and they look to see some information from our public health studies, from laboratory studies, and they determine which virus strain should be in the next set of flu vaccines. So unfortunately, that is a process that does need to happen each year to keep people protected against the most recent flu virus strains.
Thanks, everyone. We'll take a short break, and when we return, we learn more about the flu vaccine, its history, how does it work, when should we get it, how do we get it, safety of the vaccine, and benefits. Don't go away. We'll be right back.
What's up, creative family? Discover your voice with Bronxnet community media classes. Are you ready to bring your ideas to life? At Bronxnet, we offer television production classes for community members ages 18 and over, empowering you to share your vision with the world. Get certified in field production, in-studio production, and our new exciting addition, podcast production. Once certified, you can create your own show to air on one of our 6 TV channels. It all starts with our free Unleash Your Ideas Masterclass, designed to help you plan your show idea and set you up for success on your production journey. This class is offered at the beginning of each month for your convenience. Our dedicated Bronxnet team is here to support, encourage, and uplift you every step of the way. Join us and become a part of the creative force that engages and inspires the Bronx community and beyond. Sign up today and start your media journey with Bronxnet. Visit bronxnet.org/education to learn more and register. Let's create something amazing together.
Welcome back to our televised flu prevention town hall presented by Montefiore Einstein and Bronxnet Television in partnership with Bronx Health Reach. Enhancing our understanding of the role and importance of the flu vaccines, Dr. Anosike, why is the flu vaccine critical for children? How does vaccination help protect that vulnerable population?
Yeah, thank you for asking that question. And it's a very common question that we get from families when I'm interacting with parents. It's important because children are incredibly vulnerable. They're incredibly vulnerable to the flu and the complications of flu. And it's not just children, it's also certain individuals. If you're a child or an individual who has a weakened immune system, they benefit from this level of protection that perhaps maybe the body is not able to mount on itself. In addition to that, some of the more older individuals as well, particularly those older than 65 years of age, they are also at a higher risk. So typically we'd also try to promote vaccination, but also in children who can't get the vaccination. So children who are less than 6 months of age, there is no flu vaccine for that particular age. And so we also offer that to pregnant women as well too, to confer some of that protection to their unborn child into the first couple of months when the child is born. And why is it important is because with these particularly vulnerable populations, they're more susceptible to the complications. Some of the things that we talked about more particularly is being in the hospital. Being hospitalized for these children is no small thing. Just thinking about having to see your child in the hospital, maybe perhaps even to be on a machine that helps them breathe, that's a scary, scary situation for many parents. And then on top of that also too is now if the flu vaccine, depending on where it goes, can affect different parts of the body, particularly the brain, the lungs, causing pneumonia, and in some really very unfortunate situations can cause death. And this is why this is very important.
A quick follow-up. You mentioned vulnerable populations of all ages, especially the immunocompromised. Can you tell a little bit about what conditions would make a person immunocompromised?
Absolutely.
At any age?
Absolutely. There are a number of different immunocompromising conditions. And it's not just about the conditions, it's also things that can put you in a state of immunocompromised state. So what that basically means is that your own personal body, your immune system that usually protects you from infections may not be as robust or as full function or may not be present for a number of different reasons. It may be that you have cancer and you're on chemotherapy, or even may be that you are on some medications like steroids. Many people do take long-term steroids for underlying medical conditions. So these are all things that can suppress your immune system, which would normally be functioning all the time, but now your immune system is vulnerable to all sorts of viruses that can't contain it. So it really needs help by having a vaccine to boost up that protection.
Dr. Lee, what are the latest statistics or trends on flu cases and vaccination rates in our community? And how does widespread flu vaccination, at least how I understand it, reduce the strain on hospitals and clinics?
Thanks for that question. You know, this last year was one of our most severe flu season in recent history. And in New York City alone, we had over 200,000 people who had a case of flu. So when you think about that, that means how many kids who had to stay home from school, adults who couldn't go to work. And then at the health department, we work on investigating and responding to flu cases in nursing homes. So, you know, our most elderly are also vulnerable when flu is circulating in our communities. And at the same time, We are seeing a concerning trend in terms of flu vaccination. In the last year, we saw a little dip in the percentage of our population that's been getting a flu vaccine. It's hovering under 50%. It's about 48% for adults and 43% for kids. And in fact, the most vulnerable, the persons 65 years of age and older, they do have the best flu vaccination coverage at about 2/3 or 68%. But we could do better, and we think that certainly for kids, we would like to see those numbers improve, and then for adults of all ages, we would like to see those numbers improve.
Cheikhou, what do you hear from people in the community about the shots, and how can you explain the shot to people, the flu shot, in relatable terms?
Okay. Most of the people, what I hear from most of them is, some of them just think that the flu shot make them get the flu. They just think the flu shot give them the flu. So sometimes we just let them know that to go around it, we let them know that it's because your immune system is recognizing something new. That's why you think that it can give you mild fevers, just like what you said, right? Really low fevers, or reduce the severity of the symptoms. Something like that, we can explain them to make them take it. But what they hear sometimes is just like, they just think the flu vaccine make them get the flu. It's some people too that are worrying about have egg allergies, right? When they're allergic to eggs, or they're worrying about the pork products, So we make them don't take the flu mist. I think that's what they call it, right? The flu mist, or they make them avoid to take that. Most of the concern we go around it, because this is what we hear from the community. All the time we try to find out how to make them. It's so much misconception, so we have always to come to them and they let us know what to tell them so we can explain them and bring a trustful person. Sometimes it can be a nurse, sometimes it can be a faith leader, or somebody in the leaders that can explain them why they have to take the flu vaccine.
Andrea, how does flu vaccination align with caring for one another and protecting the community's well-being from a faith-based perspective?
Yes, so thanks for asking again. As I had mentioned earlier, one of the things that we do, we greet each other. We greet each other, shaking each other's hand, we're hugging, we're kissing. Kiss on the cheek, of course. Showing brotherly love. So as we do this, we're passing on, if we do have the flu, and sometimes we don't even realize that we were already exposed to the flu, we're passing it on. So what we do, in so doing, I think it's better for us to just educate in all, as much as we can, to let them know that taking that flu vaccine, and I guess maybe sooner or later we talk about the herd immunity, we need to make sure that as many of us as possible take that vaccine, so that if we are hugging and if we're kissing, we're not passing on the flu. It will protect us some way, form, or shape. It might not be 100%, but it will protect us from being hospitalized.
You had mentioned earlier that folks might say, God will protect me, and that might be a reason why they don't want to get vaccinated or don't think they need to get vaccinated. Right. As a faith leader, how do you respond to that? Well,
as a faith leader, I explain to them that God has given man knowledge, wisdom, and understanding. And so the folks that have created the flu vaccine, they got that wisdom and knowledge from God. So he's looking out, he's giving other people that wisdom so that it can protect you. Again, we say that our health is of much importance. And without good health, how can we worship God?
Let's now talk about vaccine hesitation and misconceptions. What are the reasons people might hesitate to get vaccinated for the flu?
So myth number one, the flu shot can give you the flu. Dr. Anosike, Dr. Lee, please explain how the vaccine works. One thing I learned, I'll say within the past few years, and I think many of us don't know, is that it actually takes 14 days for the flu vaccine to reach maximum effectiveness. Is that right?
Yeah.
Help us understand that.
Well, I guess we'll tag team it on this question. So how the vaccine works, and this is generally for most vaccines, essentially what the vaccine does is it sort of tells your working immune system that there is an intruder. It mirrors an intruder, not the real deal. It's almost like a fire alarm. You want to be prepared for when the real deal happens. right? And so essentially your immune system is primed and ready to go to see that there's an intruder here, and it will start to create antibodies, or what they basically call soldiers. And these soldiers are ready to say, okay, when the real deal comes through, we're ready and primed to go so that it doesn't cause havoc on the body. And so the vaccines are essentially telling the body to prepare by not giving you the actual infection itself, but giving you a pretender, so to speak. And so essentially your body develops these antibodies, but it takes time to recruit your soldiers. Which are these antibodies? That's about 14 weeks. And 14 days, 14 days. So about 2 weeks for anyone who's relatively healthy can develop that immune system, which is your antibodies, over that 2-week period to say that you're now immune at this point.
Cheikhou, how do you reassure someone who fears getting sick from the shot?
Okay, most of the time, we use sometimes our own experience. Sometimes we let them know at the beginning, just like us, you were scared to take the vaccine. After a few times, we got the flu, a few seasons, then when we decided to take it, then we was away from getting sick. And sometimes we let them know, but it's not just about you. You need to protect your family. Now, sometimes you don't know you have it and you're spreading it around your family. And we always let them know, sometimes on a short sentence, a healthy person make a healthy community. So if you're healthy, you're helping your whole community, your whole family, and your whole friends. So just do it for not only for you, but for your children, your grandchildren, and the whole surrounding. So something like that, sometimes they just, understand why they need to take it.
If I could maybe just build upon what you were just saying, Cheikhou, and also what Dr. Anosike mentioned, is that unfortunately during the period right after you get your flu shot, you might feel a bit of soreness, you might feel a little bit under the weather, you might even feel a little bit of a low-grade temperature, and that's all normal with a flu vaccine. So when people say, I got the flu from my flu shot, it may be that they're not feeling 100% for the first 24, 36 hours after their flu shot, but it doesn't mean that you actually have gotten the flu disease. The other thing is that during those 2 weeks, it's possible that you're exposed to other viruses, including flu. So during those 2 weeks when you're recruiting those soldiers, I love that, that description, that you could actually get sick with flu during that period. It doesn't mean that the flu vaccine wasn't effective for you. It's just that you didn't have enough time to build up that immunity in the 2 weeks before you actually got exposed to the virus.
Myth number 2, healthy people don't need the flu vaccine. Dr. Lee, can you explain to us this myth and also the importance of herd immunity?
Sure, and I really appreciate, Cheikhou, you mentioning this. So healthy people, unfortunately, are also vulnerable to getting sick with flu. So, so the vaccine is important for them to protect themselves. But in addition, if they do get sick, it protects the other people around them because they will be much less likely to transmit the virus to their own friends and family. And then beyond that, if you have enough people who are vaccinated, you'll get to this concept of herd immunity where the virus doesn't have as many vulnerable people to hit, and then it stops transmission much more quickly. If you have a group of people who are not vaccinated, then once you introduce the flu virus into that group of people, it can spread quite easily because people don't have that immunity. But if you have enough people who are vaccinated, the virus might infect one person and then it'll stop. So it's a really important concept.
Andrea, following up on that, how do you drive that message to people that it is about others, not just about yourself or oneself?
As I mentioned, just the education. We keep educating, and what I find is that whenever you invite others from other community to come in and to educate, my congregation at least, and we normally invite the community around, they want to come out to listen. So just educating them, and sharing as we mentioned, a few things, the herd immunity and all of those things, and letting them know it's about not just themselves, it's about the family, meaning your biological family, the community, your neighbors are still your family, and the church is still your family. Just educating them about that. I find that folks want to come out to hear, to listen. You have to build that trust with your group, your congregation also. So building that trust to let them know that you care they want to come out to listen to anything that you have to share. Flu prevention is one of them.
Myth number 3, flu shots don't work or aren't worth it because the flu strain changes. Dr. Anosike, annual updates to the vaccine increase protection, as Dr. Lee mentioned. Can you describe the different kinds of flu vaccine and also the fact, as far as I understand it, that patients are not receiving the live virus? Is that right?
Yeah.
Okay.
So that's an important question. So there are a number of different vaccines that are out there, but I want to make it crystal clear that you're absolutely right. When you are getting the flu vaccine, you are not getting the actual live vaccine itself, or rather virus itself, just to be clear. The vaccine itself is either a weakened version of that, sort of kind of like the pretender, so to speak. If you're going to be able to recognize someone who is wanted, you want to be able to figure out what their face looks like. The body needs to know what this virus looks like. So it actually is a weakened version of the actual virus, so that when the real version comes on, this big, powerful virus comes on, then you're ready to go. And you have those soldiers ready to be primed and ready to go. There are 3 different vaccines that are available. One is basically an inactivated vaccine that is actually an injection, and most individuals get this injection. Then the second one is an actual vaccine that is nasal. Now that is a live vaccine, but most individuals are not able to take that vaccine because for a number of different reasons, either because they have a poor immune system or an underlying medical condition that prevents them from getting that. And then there's another vaccine, what we call sort of a recombinant vaccine, where for those who have an egg allergy, as Cheikhou was saying, may not be able to get that vaccine if they do have a known egg allergy. So it's really important to have a conversation with your doctor who can really work with you to make sure that you're getting the proper vaccine, as there are multiple different types of vaccines for the flu, but no one of those vaccines actually should give you the virus itself. So that's the important point to illustrate.
Dr. Lee, you had talked a little bit about how we create the new vaccine each year based on sort of data from the WHO and our own national public health people. Can you help us understand that? As far as I know, what happened in the spring in Asia and Australia is, in terms of flu is used as data to help us make the vaccine for what we're seeing in the fall. Is that right?
No, exactly, Liz. So there is a meeting that the World Health Organization convenes twice a year, and with each 6-month meeting, they'll look at the data that is currently available for the flu viruses that have been circulating. And so for us in the Northern Hemisphere, we're informed by what's been happening in the previous months in the Southern Hemisphere. And so we look to see what the virus looks like, what the vaccine effectiveness looks like. They look at the safety data, all of the other types of data that are available, and then advise on what the next set of vaccines should look like for the other hemisphere. So it's sort of this constant cycle of looking at currently available to inform the next season. And I think one thing, I love the soldier and recruiting soldiers analogy. The other thing that I've heard about, and that's a nice way to think about what happens when you give somebody a vaccine, it's kind of like a snapshot of something that they may see later on. And so the vaccine itself is a snapshot. If the virus if they end up being exposed to the virus and getting infected with the virus is the real thing. So the snapshot of, let's say, a certain individual, and then the actual virus and the infection is the actual individual itself.
Myth number 4 is one that's been talked about since we started this conversation. Vaccine gives people the flu. So you've already answered that. So, but following up on that, can you mention what are some of the reactions that might lead people to think, hey, I got this thing?
I think, oh, sorry, please, go ahead.
The thing is that they might have already been exposed to the flu, and they may get the vaccine right about the same time. They don't understand, and you should understand, community, everybody should understand that the flu vaccine lessens the severity of the flu.
Right. And just to add on to that, I think that's a very, very important point. I think it's important for us as providers, and we can certainly do a better job of this, is saying, no vaccine is 100%. I think that's very important to put out there. Nothing is 100%, right? You know, I can drive my car today and tomorrow my check engine light is on. Nothing is 100%. I think it's important to say that the vaccine in itself, what we do know by multiple studies, by multiple practices that we see when we deal with patients, is that it does lessen the severity of disease. And I think that's important because, as Dr. Lee has mentioned, these things impact your day-to-day. Your day-to-day being that I will miss work, which is what we call opportunity costs. I miss work, I have to go and get a babysitter, so that's an extra cost out of my pocket. I have to pay for the hospital expenses if maybe insurance is not taking care of all the things that you need, including medications. So these are things that are important. So the vaccine lessens the severity of the disease. It may not completely stop you from getting infected, but it can certainly make things a lot easier for you in your day-to-day.
Myth number 5. Vaccines contain harmful ingredients.
So flu vaccines are some of the most widely studied and examined products, and we have over 50 years worth of experience with flu vaccines. There is a huge number of really high quality studies that have looked into safety of flu vaccines, and hundreds of millions of Americans get vaccinated each year with flu vaccines. So we do know that it is a very safe product. There is, of course, again, the side effects that we've talked about, a little bit of soreness, you might feel a little bit under the weather, maybe low-grade temperature for 24 to 36 hours afterward, but as an overall preventative tool, it is remarkably safe.
Andrea, following up on that, how to address fear or mistrust about the flu vaccines within the community, and you had talked about the importance of leaders really fostering trust. How do you address that from a moral or ethical standpoint?
Well, from a moral and ethical standpoint, we educate, we study together. We, as I mentioned this before too, we bring individuals in, other professionals in. Sometimes you are not honored in your own home, so you bring other professionals in, but because they trust you, they still want to hear from other professionals. So we bring them in and they will just educate us, and even having the actual flu clinics to come in, collaborate with the various clinics and hospitals around, and just bring them in for education. Nobody is mandated to do anything. We make sure we let them know that, but just we share a few of the points, you know, to let them understand that it's not a mandatory thing, but to share with them how it prevents them from getting chronic illnesses, or should I say expand on chronic illnesses, and that's where we kind of build the trust with them.
Thanks, everyone. When we return, building trust and increasing flu vaccine uptake. The details after the break.
There's a new channel to explore, and it's bringing the classics back to life. During the day, relive the Bronxnet originals that sparked conversations and built community. At night, dive into the hip-hop throwbacks that defined a generation. One destination, two powerful lineups. Now playing on Optimum Channel 952, Fios 2138, and streaming at bronxnet.tv. BX Legacy, where history meets the moment.
Welcome back to the Flu Prevention Town Hall, brought to you by Montefiore Einstein and Bronxnet TV in partnership with Bronx Health Reach. The next question regarding building trust and increasing flu uptake is for all the panelists. What practical steps can increase flu vaccination in our community? Some examples that we've seen out there. Free clinics, I think you mentioned that, Andrea. Folks have talked about, in the past, mobile vans, church-based vaccination events. Any and all of those? Yeah.
I can start. I deal with this distrust or mistrust in medicine on a daily basis now, and it's very unfortunate. This is not new, but it has certainly become an important issue, and part of my discussion when I'm having with families, when I'm advising on the flu vaccine or any vaccine for that matter. And I think what's most important about more than anything is what Andrea was saying, is really establishing that trust. The conversation is not a one-time event. It's a conversation that is continual and it's gradual, and you're building the rapport with this family or patient who really has concerns. We all have concerns, and to just really make sure that you're understanding where their concerns are, but also trying to minimize judgment in how you're trying to advise someone on what's the best course of action for them. Not one thing fits everybody. And so we have to sort of be understanding of that. So I think for me, in my practice in how to build trust, is really being able to have that conversation on multiple events. And then the other thing also too, I must say this, is that we have a beast called social media. And because we have social media, it's a wonderful thing because it allows us access to a lot of good information, but it also makes a lot of access to incorrect information. And so we are not in their homes 24/7 when that information is being fed to them on a feedback loop. And so what that means is that building that relationship is tantamount to a lot of the things that they're seeing right now, because then they know who to go to for a trusted resource of information. People still trust individuals like ourselves as providers and health faith-based leaders and community leaders as well.
Given this landscape, how can different sectors, healthcare, faith-based organizations, community groups, work together? I know it's easier said than done.
Yeah.
Yes, and go ahead, Cheikhou.
Okay, I'm sorry. Yeah. You know, what we do, example, at Bronx Health Reach, what we do a lot, we create events. Or we go to places like churches, mosques, businesses where we do presentations, educate people. We do all that and do vaccinations. So bringing the vaccine teams in those things, bring the trust where we can listen to people, ask them questions, build the trust. And have one of the first people that get vaccinated would be the faith leader or one of the leaders there that be the first one that get the vaccine. So once they do that, then we start bringing it up and doing more and more, and then talking to people and asking them their concerns. Let them know it's all right to have doubt, or it's all right to ask questions. But little by little, raise it up. And then we come there a few times, and then somebody that in the past didn't want to do it might decide to do it next time he see the rest of the community had it and nothing happened to them. So things like that, we do that to raise that.
And just piggybacking on what Cheikhou is saying, we do that at our church. We have health fairs, we have the flu clinics, we have all the different, just think about it, pertaining to health, we try to encourage and have at the site. So that's one good thing. Then we can educate. I find that sometimes even doing a one-on-one, I'll have individuals coming to me to ask the question, what do you think? Should I or should I not? And then we'll just do the breakdown little by little to explain why it's important. Again, it's not mandatory, but we just want them to be educated and know that you can help to prevent if you follow the various steps.
And if I may piggyback on that, I think from the public health department, maybe the two things that I'm thinking about is one, always trying to figure out how to work with communities, with really trusted stakeholders and partners like yourself. But in addition, it's also trying to understand what are the sources of mistrust and what is the sources of discomfort with, let's say, vaccination. And so it's always this sense of trying to understand, to try to address any pieces of misinformation, and to try to really address what may be sort of a gap in trust as well as knowledge.
Now, Andrea, obviously your church is very involved in providing education and vaccine events with the community. Now, for those faith leaders or other community leaders who don't see that as their role, and maybe some do, what would you say to them? How would you help them understand that it is perhaps their role to host these kinds of events or think about it?
So what I would say to the faith-based leaders who don't do the same, I would say to them, we don't just think of the spiritual, we think of the whole being, the mental, the social, the physical, and health, of course, encompasses that. And so I would encourage them to start to have that in their congregations, their community, to start to do some of that, because it is a great thing to do to educate individuals' own health.
Cheikhou, what strategies seem to resonate the most with hesitant families?
Mostly is listening to them and acknowledge the questions, like when they're worrying, it's just listening to them. And sometimes it's bringing the vaccination to the place when it's at no cost. Sometimes it's health insurance issue, sometimes it's all those immigration issues, so they don't want to go to places and go meet them. So we're trying to do it a way that is very familiar to them, the way they can, understand what we're trying to do to them, help them. Because so many different stories why people don't want to do it sometimes, and we adapt to how they come to us. If it's culture, some people we have an example of somebody that said that in the village where they came from, the only time they go to the doctor is when they're sick. So they never get vaccinated before. So the first time they came over to preach and came over here, that's when they're talking about vaccination. So they want to know what they're putting in their system. So they heard so many myths about what can happen to vaccines and stuff. So they're scared of vaccines. So once we explain them why it is for and what they help you, so this is the stuff that we make them, and use one of the faith leaders to talk to them, explain them. Sometimes we build a trust with us. If we miss it, we ask the faith leaders to help us, or the leaders of the community help us communicate with them. Those are the stuff that really help.
Dr. Lee, you talked about this a little bit, but I'm curious, what are some other things the New York City Department of Health is doing to build trust and promote vaccines?
Thank you. It's such an important question right now. Again, I think that we're trying to address and trying to understand why people might be hesitant, why people may not have much trust in vaccines, and trying to figure out how to address those kinds of concerns. And then in addition, I think we're always trying to think of innovative ways to make access to vaccines very easy, and to work with community partners that are trusted within each, and within any community it might be a different type of partner or set of partners, but really trying to understand who are trusted people and folks within communities, and trying to bring in a team of champions for public health and vaccination in particular.
When we return, we take questions from the studio audience.
And now we take questions from the audience.
Hello. My question is, how long does the flu vaccine immunity last and why?
I can take that question. So that's an important question. So how long does the vaccine last? So typically when you get the vaccine, the body takes that 14 days to mount your immune system. And then those soldiers that I was talking about, those antibodies, they can persist in your body up to a year, right? They can persist in your body up to a year. Now, I will tell you that depends on your underlying condition. So for the most healthy individuals, it can last up to a year, maybe a little longer. But for those who have an immunocompromising condition or are taking immunosuppressive medications, it may actually be less than that. In some cases, as less as 6 months. So anywhere between 6 to 12 months is where you'll have those antibodies or soldiers that can persist. And that's why it's so important that the vaccines are updated annually, as you heard from Dr. Lee, is reason for you to also repeat the vaccination every year, because the immunity starts to wane after a year.
How often is the flu vaccine updated, as you mentioned before? Well, how often is updated actually?
It is updated every year. So in the fall of each year, there is a new vaccine, because there is this process that twice a year, there's a group of people that look to see what should the vaccine look like. And we receive that in the fall each year.
How do I know if it's safe to take?
So the flu vaccine we have a lot of history with the flu vaccine, over 50 years. And as I mentioned, hundreds of millions of Americans have taken the vaccine safely during this period of time. There is just years worth of very, very high quality safety research that's been done on the flu vaccine. And it is, as a vaccine goes, very well tolerated, meaning that aside from the sort of sore arm and maybe the feeling a little bit under the weather for a day and a half, it is otherwise pretty well tolerated.
If the rules are always changing about the vaccines, how can I be convinced that the current vaccination is going to work?
I think that's a very reasonable question, right? That's how do I trust that this is working? And I think that, like I said, no vaccine is 100%, but we try to get as close to as much protection as we can get, as much as possible. We can't control how the virus behaves because it can shift. Even the smallest mutations can make the vaccine and render it not as effective in the subsequent year. So very different from the vaccine of the virus, influenza virus, there are other viruses that are circulating that are a little bit more stable. They don't shift as much. So you may think about, say, for example, if you had the vaccine to, say, chickenpox, that can actually stay in your body and it doesn't change. It's stable, and you only have to take the chickenpox vaccine twice in your life, right? But for the flu, it's a little bit shifty. It's a little dodgy. And so it actually starts to shift itself, and we have to constantly catch up to it every single time. And those are things that are being done with experts who do this as their life's job, as Dr. Lee has mentioned. And it's on a world setting where they're looking at the data constantly to feed in to make sure that we're matching as much as possible to the vaccine to match your protection for that year.
So if I'm already feeling sick, feeling symptoms, would getting a flu shot help to keep my symptoms from getting worse? And are there any risks getting a flu shot if I am already infected with the flu or some other virus?
I can take that. So unfortunately, if you are already feeling sick with the flu, getting a flu shot won't help you. So its benefit is in the prevention of you getting flu. If you already have a case of flu, getting the flu shot isn't going to help you with that case of flu. And it may not be something that you'd want to do anyway, because then you'd have both your symptoms of your flu, and then again, you might be experiencing some of the side effects of the flu vaccine. So the combination of those two might be unpleasant for you to experience at the same time.
And if I can just add a little bit to that as well, too, just so you know that what you might be experiencing, and if it's not confirmed flu, you can actually still get the shot. So for example, if you're having mild symptoms, which most individuals, if they're having mild symptoms from some sort of virus that may look like the flu, you can actually get the vaccine. Now, if you're having severe illness, as Dr. Lee said, it's probably not advisable to take the vaccine at that time. You may want to wait until your body has recovered, because now your body is really using all of its resources, those soldiers in its body, to try to contain the infection that it's dealing with then. And so now you're having to deal with the vaccine at that point, which is not probably the best thing to do. But if it's a mild cold or cough, which most individuals do have, the vaccine helps. Because remember, there may be various different strains of the virus, but not all of them are contained in the vaccine. And so you can theoretically get another strain to the vaccine that is not contained in the vaccine itself. So there's benefit to that.
Mm-hmm. And if I can just maybe piggyback onto that also, you usually get the flu vaccine at a time where there are other respiratory viruses that are circulating. Yeah. So we know COVID does, as well as something called RSV. Yeah. So I'm assuming in the situation that you're describing that you already know it's flu and you're talking about getting a flu vaccine. But people call a lot of things the flu. Right. That may not actually be a laboratory positive tested case of flu. It might be just your ordinary cold. It could be COVID. It could be RSV. Yeah. And so for that reason, as Dr. Anosike mentioned, it is important to not be discouraged by feeling a little bit unwell unless you know it's a case of flu.
Right.
important point. You're mentioning COVID right now. It is okay to take the flu vaccine and the COVID vaccine at the same time?
Sure, I can take that. It's actually a great idea to get them at the same time because it saves you another trip to your provider to get vaccinated. So we like to make it as easy as possible for people to get vaccinated, and in which case, if you are eligible for the RSV vaccine, you could actually get your flu vaccine, your COVID-19 vaccine, and your RSV vaccine all at the same time. In general, we'd like to make it as easy as possible. If, for whatever reason, an individual has strong objections to doing that, you can space them out. But given that they are helpful and you could get them at the same time, we recommend doing so.
And if I might just piggyback, if we do give it to you from the clinic setting at the same time, we'll give it to you in different, separate arms.
Yeah, that's a good point.
Yeah. Before I proceed with my question, I want to share a little anecdote, if that's okay. I'm one of those that took the flu vaccine for the first time and got very, very, very sick. Then I refused to take the vaccine for many, many years. And I will bring the clinic to my people where I worked at and refuse to take it myself, which is a bad example. So later on, many, many years ago, I developed influenza, sadly. And I got so sick, I thought I was going to die. After that, I got so scared that I decided to give it another shot. And I have been taking the vaccines ever since. Now, with that being said, what is the difference? And I know you went over it slightly. I would like to learn a little bit more. What is the difference between a live vaccine versus a dead vaccine? And why some of us get sick from one and not the other?
Yeah. First, thank you so much for sharing that account of what you've experienced in the past before, and it's really, really, really hard for any one individual to be faced with something like that. I will say that each individual's body is different, even with your kids, even with your parents. Your bodies are all individually different, and depending on what sort of conditions you may have, your body is going to respond differently in the same way or the same vein that if you ate something, you may like certain things that are very different from the next, and your body is going to respond very differently. I'm not exactly sure what may have happened to you when you had the first vaccine, but is it entirely possible that you had a reaction to that vaccine? It's entirely possible that could have happened. But I will say that the difference between the live vaccine versus the non-live or inactive vaccine is the live vaccine actually, in this case, we're not dealing with the flu vaccine, is a live vaccine. But when we're talking about the actual virus itself, it has far more severe symptoms, as you've already told us. Severe fevers, chills. You may even find that in some cases that you're having really bad cough and chest pain that is synonymous with maybe a severe pneumonia. Different from the inactivated or non-live is what you get as the vaccine is a weakened version of the virus. And so what you may see at most, for most healthy individuals, is that you may have a very mild fever or mild pain at the site of injection or redness, things like that. But you shouldn't see full-blown symptoms as you would see for the live virus itself.
Any more questions?
And for those who are living with chronic diseases, what would you say is the prevalence of them not receiving the flu vaccine, and what recommendations do you have for those individuals?
I can take that, sure. So I don't have specific numbers for how many people with underlying conditions get the vaccine. We do know that, as Dr. Anosike mentioned, there is a list of people that we know will have have a risk of having a much more severe course of disease with flu. So clearly it is important to speak with your healthcare provider, but generally there is a very small number of groups of people that should not get the flu vaccine. Otherwise, there's a very long list of conditions that for which flu vaccine is really important. It could be diabetes, having a heart condition, immune compromising conditions, as we mentioned. Pregnancy is another one that's really important to mention. Obesity and neurodevelopment disorders. All of these conditions can mean that you will have a really higher risk of becoming much more sick with flu. So for those groups, I still have a strong recommendation to vaccinate.
And I just want to add one quick thing that is also important is if you have an underlying condition or chronic condition or immunocompromising condition, it is important to have a conversation with your doctor and have that shared decision-making process, because what I would like to say is some protection is better than none. And that's really important. We would say that in any other setting outside of medical situation. Why is it not applicable to the medical setting? You would want to be protected under all circumstances. We do that for our children every day. We do that for our parents every day. We would want to do that for ourselves. And so that's sort of the mentality. Again, it's a conversation. It's not by force. It's not mandatory, as Andrea said, but it is something that we can have a conversation about what is going to be optimal for you, right? Given the things that you're concerned about.
Thanks everyone for your questions. In the final few minutes that we have, any final thoughts from everyone or anyone in the panel?
I'd like to say that God gives man the knowledge, the wisdom, and the understanding to create these vaccines. 1. 2, it protects you and protects your family. It's not just about you. It's about you and your family, and you want to protect against this virus.
Cheikhou, you want to talk? You want to say something?
She just said almost what I was going to say, but I was going to just reduce it by saying, just like I always say, a healthy person make a healthy community. So once they know that, they would worry about not spreading the flu to other people, Like I always say, if you believe in God, so you should believe in one of these shows. Whatever you want for yourself, you should want it for another person. So you should get the flu to protect yourself, protect your family and others.
I certainly support everything that you've just mentioned. And I think it's also important for us to talk with each other about vaccination and try to understand if you have friends or family who are feeling hesitant or concerned about getting vaccinated, then to talk with them, to really engage them so that they continue to be a part of the conversation about prevention, because that is such an important link to keeping us healthy.
Yeah, I echo the sentiments of my fellow panelists here, and it's a decision that is just a continual conversation. The conversation doesn't have to stop here on this panel. It's a conversation that takes place once you walk home, once you continue to have questions. We're here for you. And so I think it's most important to make sure that we know that we're all trying to do what's best in our day-to-day lives and try to do what is best for the community, or a community shield is another way that I put it. And so these are things that are there and available to us, and it helps us to be stronger and better.
Well, there you have it. Thank you very much for being here today. On behalf of Bronxnet TV
and Montefiore Einstein, we thank you for joining us.
Please spread the word and share this content with others.
As our wise panelists have said, please keep the conversation going about Bronx health and the local health issues that matter most. Until next time.
Until next time.